Good morning, everyone. Thank you very much for coming. My name is Tom Chandler. I'm the Dean of the Arnold School of Public Health. And I'd just like to say that this is a truly remarkable day in the history of the Arnold School. And it's also a wonderful way to mark this special week. This is National Public Health Week, April 5th to the 11th. And I can really think of no better way to mark this week than by a visit from Congressman Jim Clyburn. Jim's agreed to come and deliver the third annual Health Disparities Lecture that's named in his honor. This is the James E. Clyburn Lecture in Health Disparities. I'd like to welcome you, Congressman Clyburn, if you would just stand and be recognized, and also any members of your family and your friends. We have a number of other special guests in the audience that I'd like to recognize. If you would just stand as I call your name. Miss Elizabeth Newton, who's established a number of scholarships in the Arnold School. Please stand, Elizabeth. Thank you. Members of the Orangeburg City and County Councils that are here today. Mr. Bernard Hare, Mayor Pro Tem of Orangeburg. Dr. Sabra Slaughter of MUSC, President Cleveland Sellers and Dr. Leroy Davis from Voorhees College, Ms. Michelle Williams from Benedict College, Dana Campbell and students from Allen University, Dr. Verley Tisdale and students from Claflin University, Dr. Gerald Polinsky, Dr. Leroy Staggers, and students from Morris College. Brandy Wright and students from South Carolina State University. Principal Marvin Byers and students from Lower Richland High School. Thank you all for joining us today. Now, in Congressman Clyburn's role as House Majority Whip, we all saw firsthand the key role that he played in the passage of the Health Care Reform Act legislation this spring. And during this frequently contentious debate, I was especially struck, Mr. Congressman, when you spoke of health care reform as the Civil Rights Act of the 21st century. I grew up during the Civil Rights Act. I was a little tow-headed white boy in Hamlet, North Carolina, not far from here. It made a very large impact on me. It's one of the reasons I gravitated to public health, in fact. But I agree with you, sir, wholeheartedly that this is exactly what this legislation is and will mean for our children, for the poor, for the disenfranchised, the mentally ill, and for those among us with chronic diseases who can't afford or can't obtain adequate health insurance coverage. This landmark health care legislation, which, similar to the Civil Rights Act, was literally decades in the making and which struggled through to the final vote with your help, will have a similar profound and positive impact on the many socioeconomic and racial health disparities that exist in our society today. For example, when one compares minority health statistics with those of white Americans, the United States Department of Health and Human Services reports that African Americans are nearly twice as likely to have a stroke. African American men who do have a stroke have a 60% higher incidence of death. African Americans have higher infant mortality rates, higher rates of diabetes, are 1.5 times more likely to have high blood pressure, are more obese, and they will die at significantly higher rates from many types of cancer. And our own Cancer Prevention and Control Program had a seminal study released last year that showed or uncovered that dismal statistic for the state and for our region. I'm very proud to say that my college, the Arnold School of Public Health, has many faculty and students, many of them at this lecture, that are involved in scientific studies focusing on and recognizing and also correcting these health disparities. Many of them lead significant outreach programs with minority populations throughout our state and even in the nation. Our mission to improve and promote the health of the public through a focus on disease prevention has remained faithful for over 35 years. We're actually in our 35th anniversary this year. Similarly, Congressman Clyburn's commitment to the health of the public has never wavered during his many years of public service. His stalwart belief in the need for health care reform sustained him through a very tough recent battle in Congress. I asked him in the break, had he had a break yet? He hasn't had a break since that fight. I know he's tired, and we'll get to Hilton Head after this, I understand. But his stalwart belief in the need for health care reform sustained him. He fought the good fight. He won that battle. We're very grateful and indeed proud that you're here with us today, Congressman Clyburn, to talk with us about health disparities and your congressional experiences. So thank you very much. I'd also like to thank the faculty and officials that are here from Claflin University for their partnership with the Arnold School and our educational and health disparities programs. Your support and the educational and research collaborations that we have with you are very important to us, and more importantly, they're very important to the people of Palmetto State. So thank you for that. Now I'd like to welcome our second guest on the agenda, Dr. Stephen Kresovich. Stephen is USC's Vice President for Research and Graduate Education. He came last October from Cornell University, and he'll make a few remarks. Steve?
Good morning. It's great to be here. On behalf of President Pastides, I would like to thank you all for coming to this event at the University of South Carolina today. And I'm especially grateful to Congressman Clyburn for taking time in your busy schedule to be with us. Before coming to Carolina last fall, I had long been aware of Congressman Clyburn's work and commitment to health care and his leadership in the U.S. House of Representatives. Like you, I followed his efforts to pass this monumental historical health care reform legislation that will have an impact for years to come in this state and across the country. As a new South Carolinian, I thank you for your efforts, your commitment, and your tenacity. When I was being considered for the Vice President's position here, I had the great opportunity to learn of the breadth of work that was going on and the significant amount of research underway at the university on health disparities, which affect too many children, too many women, too many adults in the United States. Health disparities are the gaps in health care that exist between minorities and non-minorities, and that's really a simple explanation. But in reality, health disparities are much more complex. And despite advances in medical sciences and biomedical technologies, many minorities still suffer disproportionate rates of diseases and early death. Some of the reasons for these health disparities remain unclear. However, we do know that access to health care is a major factor and quality of health care is another. At the University of South Carolina, our faculty are engaged in a range of research in health disparities from across many disciplines, including not only Tommy's College of Public Health, but the School of Medicine, the School of Social Work, Nursing, Pharmacy, and Fundamental Sciences in the College of Arts and Sciences. This research is critical to the Palmetto State and the nation. The Arnold School of Public Health is dedicated to helping us understand the magnitude of health disparities in South Carolina, which in turn is going to give us the path to the future so that we're able to find solutions in this area. The Arnold Institute for Partnership to Eliminate Health Disparities plays a critical role in this effort, and the collaboration between the Institute and Claflin University yields positive results, especially in the education of public health professionals who will serve our state and nation, as well as training the next generation of public health specialists. Another study last year that Tommy highlighted, the South Carolina Statewide Cancer Prevention and Control Program, did a thorough job of highlighting the prevalence of different types of cancer across the state of South Carolina. More recently, the Institute for African American Research at Carolina held its first annual conference, and researchers from campuses across the state joined some national leaders to discuss many factors that affect health care in our state. And through the USC-Claflin partnership, we have great researchers recognized nationwide that are studying diabetes, obesity, prostate cancer, colon cancer, breast cancer, and cardiovascular diseases, all important issues in the 21st century. I'm really proud of the progress that's been made and really look forward to being part of the future successes. During Public Health Week, we consider the future for limiting health disparities. It's important that we focus on the education of the young people who will be the future public health professionals, doctors, nurses, pharmacists, scientists, and community leaders. They're the ones who will take what we're learning today and apply it to solving problems in the future. I'm really looking forward to the session today. Sandra, thank you very much for the opportunity to be here. It's going to be an enlightening session. And it's now my pleasure to introduce Mr. Drexel Ball, Executive Vice President at Claflin University. Mr. Ball is here to present a message from Dr. Henry Tisdale, President of Claflin University. Mr. Ball.
Thank you and good morning, everyone. I bring you greetings from Claflin University and our distinguished president, Dr. Henry N. Tisdale. There's very little for me to say other than to thank all of you for coming this morning to this important lecture. With the condition of health, there is no debate that we must come together to do all we can to improve and promote good health in our state and in our nation. Claflin University is very pleased and committed to be a partner in this great enterprise, in this great initiative. And Claflin will do all in its power to expand all the energies and power to help improve the quality in life in our state. Personally, I am not surprised at the leadership of our distinguished congressman because as a student in his class in high school at Charles A. Brown, he taught us in high school. He asked us the question, what is your purpose in life? That's what he asked us. Make sure you know what your purpose in life is all about. And it is our purpose, if we are in a position to improve, to help others, that will be our legacy. And the challenge to you this morning, that if you are in a position to help, to do that, let it be our legacy to improve health care in the state of South Carolina. Congressman, again, we appreciate you for the work you're doing, and Claflin will be committed to do its role to make a difference. Thank you this morning.
Hello, I'm Kristen Mason. I'm a junior at Claflin University, and I'm also Congressman Clyburn's intern this semester. On November 16th, 2006, the U.S. House of Representatives Democratic Caucus unanimously elected Congressman James E. Clyburn of South Carolina to be its majority whip, a position he continues to hold in the 111th Congress second session. Clyburn became the first South Carolinian and only the second African American to ascend to the third-ranking position in the U.S. House of Representatives. His humble beginnings as the eldest son of an activist, fundamentalist minister, and an independent, civic-minded beautician grounded Clyburn securely in family, faith, and public service. He graduated from Mather Academy in Camden and became a student leader at South Carolina State College in Orangeburg. He was elected president of his NAACP youth chapter when he was 12 years old, participated in marches and demonstrations during the Civil Rights Movement, and was the star witness in the 1960 Orangeburg civil disobedience case defended by the legendary Matthew Perry. That case developed from the arrest of 388 college students, including Clyburn and Emily England of Moncks Corner. He was jailed during the 1961 march on the state capitol in Columbia, a march that was part of the landmark case, Edwards v. South Carolina. Clyburn married Emily England on June 24, 1961. They began their personal and professional lives in Charleston. He is a history teacher, and she is a librarian in the public school system. Clyburn's dream of a career in politics began with the 1970 run for the SC House of Representatives. Although he lost the race, Clyburn was asked by the newly elected Governor John C. West to join his administration as an advisor. About 4 years later, Governor West appointed Clyburn to serve as the SC Human Affairs Commissioner. In 1992, Clyburn resigned as the Human Affairs Commissioner to pursue a campaign for the U.S. House of Representatives. He won the general election for the 6th Congressional District and was sworn in as a member of the U.S. House of Representatives in January 1993. Clyburn was elected co-president of his freshman class. 6 years later, he was unanimously elected chair of the Congressional Black Caucus and to a seat on the coveted Appropriations Committee. In 2002, he was elected to serve as vice chair of the House Democratic Caucus, and his peers unanimously elevated him to chair of the caucus in January 2006. Clyburn is a leader of the House Democrats' Faith Working Group. The Clyburns have raised more than $1.5 million for an Archives and History endowment at SC State University, which has named campus facilities in their honor. They have 3 daughters, Mignon Clyburn, Angela Hannibal, and Jennifer Clyburn Reed, 2 son-in-laws, Cecil Hannibal and Walter Reed, and 2 grandchildren, Walter A. Clyburn Reed and Sydney Alexis Reed. Thank you.
Thank you. Thank you very, very much. And thank you, Christian, for presenting me here today. And I use that term advisedly because usually I would consider an introduction this time of year in the 6th Congressional District to be out of order. If I need to be introduced at this particular juncture in my life, I'm in serious trouble because this is an election year. Let me thank all of you for being here. I see a lot of friends, and thank you, Drexel, for really giving me some credit for whatever you've done in life. I followed you for a long, long time, and I was very pleased when you decided to come back to South Carolina after making such contributions elsewhere. Drexel had a lot of young people in his class that I have stayed in touch with over the years. It's kind of interesting because in the years I spent in the classroom at high school level, I remember a lot of students, and I run into a lot of them all over the country. In fact, last night I was over in the PD, and a young lady came up to me and says, "You know, I don't think I've ever told you this," and she is quite a successful young lady today, but she says, I went to Shaw University back in the 1960s. I was one of those students that you put on the bus to send to college. And when I run into them, I think about what it is that can happen to young people when they're given the opportunity. We sometimes look at the circumstances within which they are born and raised and sentence them to very low expectations. And it was my great pleasure to be teaching on Charleston's east side, which at that time was the most densely populated area in the state of South Carolina. And most of those students, I'm sure the director would not mind me saying this, were not expected to do much. And so I'm so proud when I go up to New York, as I will next weekend, and one of the first persons I see will be Ralph Dawson, who is a Wall Street lawyer who got put out of school when he was in the 10th grade. And I got a call from one of his buddies. I had already left the classroom, who told me that he had been thrown out of school. And I went to his house, and I said to him, I said, you know, Ralph, I heard what happened at the school today. Get in the car, we're going back to school. He told me he was not going to do that, because I told him he had to apologize to the teacher. Of course, I'd already talked to the teacher. She would not, she would accept the apology. And when she told me that she would, Ralph said he wasn't going to do that. Well, times are a little different today, so I cannot tell you what I said to Ralph. But he went back to school and went on to Yale University Law School and became Howard Dean's roommate at Yale. Howard Dean, of course, pursued a life in medicine, and he went to law. But I think about those young people when I think about this health care bill. Now, I've got some notes here that I'll use if I need to refer to them during the Q&A. But I'm going to just say some things to you now that I feel like saying, and I hope they are a little bit edifying, if not educating. When I took to the floor on the afternoon of the vote, I, as part of the leadership, you tend to either open up or close the debate. I opened up the debate by saying that I thought that when all is said and done, this bill will be considered the Civil Rights Act of the 21st century. Now, I said that because of my experiences. I say all the time that none of us can be any more than what our experiences allow us to be. No matter what you may think you are, what you may want to be, the experiences that shape you will determine pretty much how you view the world and how you react to the world. Now, my experiences growing up in Sumter, South Carolina, in the 40s and 50s, helped to shape me. My experiences on the campus of South Carolina State University, at the time South Carolina State College, helped to shape me. My experiences teaching in a public high school in a very low-income area, running the South Carolina Commission for Farm Workers, working with migrants and seasonal farm workers, spending 4 years in the office of the governor trying to make sure that the policies of the state were different going forward than they had been in the past. My experiences at the South Carolina State Human Affairs Commission, I see at least one of the employees there. So good to see you, Mary. My experiences for almost 18 years looking at inequities that exist in the system. And then I thought about the conversation I had with President-elect Obama on the day that he returned, or the day after he returned from his Hawaii vacation after the election of 2008. I thought about that conversation. We were in sort of a roundtable discussion, and you all may recall that the centerpiece of the campaign for almost 2 years was health care. It was not until late in the campaign, almost around the time that the final stretch of the election took place, when all of a sudden we got that visit from Henry Paulson late one night telling us that something was drastically wrong up in New York in the financial centers of the country. Nobody knew it was coming. Well, at least we didn't know on Capitol Hill. And when Paulson came in to tell us, that changed the game. But everybody expected for health care reform to be the number one issue going in to the new administration. As we went around the table in that discussion, when it came time for me to speak, it was a bipartisan, bicameral leadership meeting. That is, the top three positions in both the House and the Senate, and both the Democrats and the Republicans. So it's the top two positions on the Republican side, and top three on the Democratic side. And we always speak in a round robin according to seniority going back and forth between the House and the Senate. When it came time for me to speak, I said, Mr. President, I wish to let you know that I have studied the history of this great country of ours. I know that we are faced with a crisis unlike anything we've seen since 1929. I also know that in our response to that great crisis, we developed something that became known as the New Deal. Franklin Delano Roosevelt became lionized because of the New Deal. But I said to him, I says, now, when you hear me talk about the great presidents, you very seldom hear me mention the administration of Franklin Roosevelt. Because the New Deal was, in fact, a raw deal for many of the communities that I represent. Because those of us who know the history, you know the WPA, CCC, those programs were, in fact, the stipulation in those programs were, in many instances, in the communities that I represent, white only. That's what they were. Go back and read your history books and you'll find it. I said, now, many of those communities that were left out of the New Deal, I am now representing. Now, what I am going to insist upon, Mr. President, is that whatever we do in responding to this crisis, whatever we do in reforming health care, whatever we do in reforming education, I will not be silent if we do not make sure that all communities are being treated not equally, but equitably. Judge Finney, equitably. I'm one of those people who really feel, and I say this all the time, that sometimes in order to treat people equally, you have to treat them differently. I have 3 daughters. I love them. My eldest, Mignon, is in Washington, now a member of the Federal Communications Commission, doing an outstanding job. She's very independent. We used to be in business together for 10 years. I would tell her what I thought. She would listen very attentively, bow her head in agreement, and when the conversation was over, go right on and do whatever it was she was planning to do in the first place. My number 2 daughter, Jennifer, is married, has 2 children. My 2 grandchildren, 13 and 15, are her children. But for some strange reason, she always wanted to get her father's approval for everything, no matter what it is. I get a call from her, well, Daddy, what do you think? And often I would say to her, now, Jennifer, go ask your husband. I gave you away. Now, my number 3 daughter, Angela, many of you know Angela. I call her my free spirit. Whatever happens, it's all right. It just rolls off. I love her to death. But you know, if I respond to those 3 young ladies equally, I would not be a good father, because their needs are different. Their attitudes are different. They see things differently. And I need to respond to them according to their needs. And that's why when we look at things like health insurance reform, things like economic opportunities, things like educational opportunities, it behooves us to look and see where the needs are, what communities need to be targeted, what groups need to have added incentive and support in order for us to move our country along the path it ought to be following. So it doesn't mean that you like somebody better than the others. For some strange reason, we seem to feel that if you open up an opportunity for one group, you are closing down the opportunity for another. Nothing could be further from the truth. What we're trying to do in all of these things is try to make sure that people are responded to according to their needs. Now, I'm not too sure the president really appreciated all that I was saying on that day. I know some of my colleagues didn't. But as we walked through this health care debate, things were all about what we needed to do to get to 60 votes in the Senate. Now, I started saying about a year ago, before last August when we had all of those town hall meetings, that I didn't accept 60 as the magic number for health care. I thought that the magic number for health care ought to be 50 plus 1. Many of you may remember, I said it time and time again. I remember on CNN one day, a reporter said to me, he says, you know, why didn't you say this? This was in September when I was talking to him. He said, why didn't you say this before y'all left to go on your August break? I said, I was saying that. Y'all just weren't listening. He said, well, we're listening to you now. I said, well, I'm going to say it again. Now, the reason I held on to that is because I felt sincerely that what you would have to do to fashion a program to get 60 votes would be so limiting until the foundation that we need to build upon could not be solid enough to have a good program going forward. Now, I never felt, and still don't feel, that whatever we did in this instance will be the last time that we visit this issue. I don't know why everybody felt that this had to be some lopsided vote. We've never had lopsided votes on these kinds of contentious, big issues. We've always had to break filibusters in order to get a big issue moving. We ought to know that in South Carolina more than anybody else. In 1957, a lot of people think it was 64, but in 1957, the first Civil Rights Act that was passed in 1957. It was subjected to a filibuster. In fact, our beloved senior senator set the record filibustering against the Civil Rights Act. That not only was it a contentious filibuster, but some of you may recall the issuance of a Southern manifesto. A manifesto that was signed, that was refused by people like Al Gore Sr. of Tennessee and Ralph Yarborough of Texas, Southern senators that refused to sign the manifesto. A manifesto which was saying we will unite in opposition to civil rights. And those Southerners who refused to sign lost their elections because they felt that everybody ought to be treated equitably. And so I understood that. I've studied that. I didn't feel you would ever get 60 votes to do what needed to be done to lay the foundation. After we broke the filibuster in 1957, then came 1964. Another filibuster arose. This time, Lyndon Johnson used his relationships with J. Everett Dirksen, the senator from Illinois, and they were able to break the filibuster and pass the 1964 Civil Rights Act. Now, they didn't pass the 1964 Civil Rights Act until they first took out voting. A lot of people don't realize that. There are people they say, oh, that's the Civil Rights Act. We ought to do this, that, and the other. And I remind them, first 57, then 64. Then a year later, the Voting Rights Act came in 65. Then 3 years later, the Fair Housing Law came in 1968. And then 4 years after that, we outlawed discrimination in the public sector in 1972. So over that period of time, we got to what everybody look back now as one piece of legislation. It was not. We hear all the talk today among my friends on the other side of the aisle says, you know, Social Security was passed with this big bipartisan vote. That's true for those people who look at the final vote. But the fact of the matter is, the vote, the real vote on Social Security, did not pass with a big vote. That vote, that final vote, was just after the opposition failed to gut the bill in a very close vote. When they failed to gut it, they knew the final product was going to pass, and then everybody jumped on board. Go back and check it. Social Security didn't pass in the substantive sense. It was a very close vote. Medicare. Everybody today loves Medicare. But at the time Medicare was being voted on back in 1965, it was a very contentious issue. So I don't know why we are so concerned about this vote being a close vote. We usually look back on this and just think about this. 1965 Voting Rights Act. That's how I got to Congress. I wouldn't be in Congress today but for the 1965 Voting Rights Act. And when you talk to people, they say, you know, I wonder why we had such a hard time saying it's all right for African Americans to be able to vote. That's all we were saying. Removing obstacles, like how many bubbles in a bar of soap, which was one of the questions once they had asked to determine whether or not you had enough intellectual capacity to cast a vote. So when you have these kinds of things, you've got to wonder, why is it so hard? Somebody got to explain to me why we ought to allow insurance companies to say to the mother who sent me an email last week from Florence, South Carolina. She said to me, she says, the night of the vote, I sat up to watch the vote. And the night of that vote was the first time I was able to sleep in a long, long time. And she went on to tell me about her daughter, 8 years old, with cancer. 8 years. And her treatment. And she said just a few days before the vote, I got a letter from the insurance company telling me that my daughter had reached her lifetime limit and would no longer be covered for health care. An 8-year-old whose cancer is now in remission, but will never be able to have health insurance anymore. Think about the lady who came to stand with us in Washington who had been subjected to domestic violence and was denied insurance because that is considered to be a pre-existing condition. I'm not making any of this up. It's all there. Think about the lady who called into the radio program that I was doing. And I'd just been chastised by a gentleman who called in to tell me that he didn't like what we were doing in Washington. He had insurance, he liked his insurance, and he didn't want anybody messing it up. A lady called in a little later. And she said, Congressman, I want to say something to that gentleman that called in. Or some of you may have heard the program. It was right here in Columbia. She said, I'm 48 years old. 2 years ago, I was diagnosed with breast cancer. I've been paying in my policy since I was 21 years old. I thought I liked what I had until I tried to use it. So I want to say to that gentleman, maybe he likes what he has because he's never tried to use it. Because she had already gotten her letter telling her that she was being removed from coverage. Now, I know that's why I call this a Civil Rights Act. This is a Civil Rights Act because it ends discrimination against people with pre-existing conditions. It ends discrimination against people who may contract a catastrophic illness. It ends discrimination against 21 and 22-year-olds who leave the University of South Carolina and want to go on to graduate school but's been kicked off the parents' insurance policy at 21. You can stay on until you're 26. It ends that kind of discrimination. That's what we're doing here. And I'm going to tell you another very egregious discriminatory action that this ends. And I really didn't know this until I got into this research. I just told you I have 3 daughters. It became very personal to me. I did not know that women were paying twice as much as men, for the same coverage on their premiums. Now, when I asked one of my friends in the insurance field about this, he said to me, well, women are subjected to things like breast cancer, and they went into all these domestic violence. I said, wait a minute. Have you ever heard of Al Green? You ever heard of Al Green? Look here, tell me something. What woman do you know that's had prostate cancer? I mean, so what kind of foolishness is this? I mean, the prevalence of prostate cancer, especially in South Carolina, is there, especially among African-American males. So you're going to tell me you're going to charge twice as much for breast cancer as you do for prostate cancer? I don't quite understand that. There's no rhyme or reason to much as what that's been going on in this field. And so what we're trying to do is pull this together in such a way that we can lay a foundation. This is not going to be the last time that we visit this issue. We're going to be visiting this for a long time. Now, I know some of you may have come to hear about what we're going to do for children, what we're going to do for those pockets that I talked about with African Americans. We address it in this bill, and I'm sure that you have questions about it. And to all those questions, I'll try to answer them. I brought this little cheat sheet, if you can call this a cheat sheet, in case I need to refer to something during the Q&A. But let me thank you all so much for being here. Thank you so much for your interest in this area. I know that the talk of repeal may be attractive to some of you, but I'll just remind you that the last time I saw the Attorney General of South Carolina raising this kind of a ruckus about not obeying a federal law, it was all about the integration of schools. It was all about the integration of schools. I remind you that we hear all this talk about repeal. The last time I heard a leader, political leader from South Carolina, talk about repeal, some of you may not remember this. Now, you know, at 69 years old, I've got what we call that long-term memory. So I remember right after the 1968 elections, when Richard Nixon was elected president of the United States. Our senior senator went on the front steps of the State House and announced to everybody in the state how happy he was with the results of that election. And he was going to Washington the next day, and the first thing we want to do is repeal the Voting Rights Act of '65. That's what was said. So I'm not the only one to see this as the Civil Rights Act of the 21st century. It seems to me that a lot of other people see this as a Civil Rights Act as well. And let's hope that their success in the courts and the legislative bodies meet with similar results. Thank you.
I'd ask Dean Chandler and Dr. Ball and Dr. Kresovich come up with Congressman Clyburn. We'd like to do the perpetual plaque first. As many of you remember, at our first lecture, we started this plaque that we house at the Institute for Partnerships to Eliminate Health Disparities, and it bears the names of our lecturers. Starting with Dr. Jones in 2008, Dr. Troutman last year, and it's very significant that Dr. Jones reminded us of the health disparities and the fact that these disparities had not changed or improved in the last 2 decades. And then Dr. Troutman brought us back full circle and talked about the social determinants of health, that we can't just focus on the illness and disease, but we also have to take in consideration the social determinants. And now this year, April 9th, 2010, Congressman Clyburn, we have you here to, and we've certainly already inscribed the plaque with your name, but it represents more than just the fact that you're here to deliver the keynote address. It also represents your efforts in improving the health of all citizens in this country, and for that we are truly grateful. We're going to change the agenda just a little bit to make sure that we have time for your questions, and the Congressman has agreed to entertain questions. So what we would like for you to do, there are cards in your seats that have been placed in each seat and for your convenience. And if you have a question you would like to pose regarding the health care legislation or as it relates to health disparities, please write down your question and pass your cards to the end of your rows. And then we'll have our host and hostesses pick those cards up, and they will be read by a moderator for the Q&A session. Laurel Wilkinson will read each question, and I'm sure the Congressman will answer. He answers all questions, he says. It may not be the way you expect, but all questions are answered. So I will give my closing remarks, and then I'll ask the Congressman to come back on stage to entertain the questions. Now, this is a significant day, and I'm going to take some liberties. So I know already that Mina and Crystal, my administrative support team, are getting nervous because when I go off script, they get nervous. But I think we need to revisit some of our special guests that we have here today, because it's significant that we have representation from our partner institutions. So when Dean Chandler recognized the groups, I know students sometimes you're a little nervous about standing up when you're asked, when you're recognized. But I want to go back, and I want to recognize the groups from Allen University, and I want you to stand. I want every student from Allen University to stand. Thank you. Benedict College, please stand. South Carolina State University, please stand. Morris College, please stand. Laura Richland High School, I think you did a good job when I think everyone stood. I'm so glad to have you here. Last but not least, our partner institution, Claflin University. Please stand. I'm going to recognize our partners in just a few minutes, but I want to share with you that, as you have already heard, the health care reform bill that President Obama signed into law March 23, 2010, Congressman Clyburn took the lead in that effort. He championed it. So I don't know what that means to you, but I know what it means to me. And I think we need to recognize the efforts that went into that. And this is a time of rejoicing. Yeah, we got a lot more work to do, but there's nothing wrong with being happy with what we've accomplished at this point. So don't be shy about being excited about what has been accomplished. Now, this new legislation aims to accomplish a number of goals, and you've already heard about the coverage of millions of Americans. You've heard about comprehensive prevention, service delivery, research, and evaluation. All of these are cornerstones of the Institute for Partnerships to Eliminate Health Disparities that I direct. Our mission And all of this will be a permanent part of our nation's healthcare system. While the passage of the legislation will certainly help to advance our mission of eliminating health disparities, legislation alone will not achieve our goal. We cannot achieve our vision of eliminating health disparities without engaging in healthy, meaningful dialogue around the many issues that our communities continue to face, to include chronic disease, racism, poverty, segregation, substandard housing, and high rates of unemployment. We believe that we have found an effective method of engaging in meaningful dialogue with researchers and community members to enhance public health research, the efforts to eliminate health disparities through the establishment of a series of town hall forums. These forums are aimed at bridging the gap between Washington and small-town USA, and we've been doing it for the last 5 years with our support from the National Institutes of Health, and we are thrilled to announce our plan to continue to use the Clyburn Lecture as a springboard for these types of forums. These forums facilitate healthy dialogue with grassroots organizations and individuals to discuss the implications of health care at the community level. What does this legislation mean for us at the community level? It brings together community leaders, organizers, everyday citizens, uniting to educate and empower individuals and communities to be proactive about their health and to develop long-term solutions to the recurring health issues that our communities continue to face. I certainly want to take this opportunity to thank Congressman Clyburn for his support of our institute that was formed 7 years ago in April 2003, and we've been building and growing ever since. Certainly I want to thank Dr. Chandler, Dr. Kresovich, Dr. Ball on behalf of President Tisdale at Claflin, Kristen for that introduction, and certainly the Congressman for all being a part of our program today and demonstrating a shared commitment in supporting and moving our initiatives forward. I would be remiss if I did not thank, in his absence, President Pastides for his leadership and long-standing support of the Institute and our efforts to strengthen academic community partnerships while working toward solutions to eliminate health disparities. Now, I need to recognize, again, the group from Claflin, because we have not only faculty and staff, we have students from the Public Health Alliance, we have students from our HPV task force that was started under our funding for our Center of Excellence in HIV and cervical cancer, and we have students and members of the Introduction to Public Health course that was also an initiative under that same funding opportunity. And we also have graduate students in Claflin's biotechnology program. We're glad you're here. We certainly appreciate your support and your attendance. The Public Health Alliance is something that we started with the funding from the W.K. Kellogg Foundation in 2003 and worked with every institution that's represented here as a partner, including our own University of South Carolina, to create these alliances to ensure that we focus on public health careers and have students at multiple levels focusing on eliminating health disparities. I certainly want to thank our faculty from the University of South Carolina, students, and some very special guests who are with us this morning for your support and attendance. Now, we did a lot of changing over the last couple of weeks, and it was critical and important for us to have Congressman Clyburn this year. Everything happens for a reason. Everything happens according to plan and purpose. And it is this year that he had to be the speaker. No one else could have done this. So we had to work very closely with USC Printing Services, and they worked with us, turning on a dime to get materials to us quickly, and we certainly appreciate that. The Planning Committee, what can I say? For this event, we have been together for 3 years now, and I certainly appreciate your hard work and working to pull together what I deem another very successful James E. Clyburn lecture. I would like to recognize our community partners, because what we do, we could not do without our partners. And we have Claflin University, I've already recognized, but again, strong partnership. Ms. Shirley James and the Minority AIDS Council from Orangeburg is here. We work very closely with Palmetto Health. I'm not sure if anyone's here from Palmetto Health and their Office of Community Services. South Carolina Area Health Education Consortium, the South Carolina Commission for Minority Affairs. I know Ben is here this morning. I'm not sure Janie's here. The South Carolina Department of Health and Environmental Control, Commissioner Hunter, and certainly the Office of Minority Health, Shauna Hicks, and certainly Dr. Waddell. South Carolina Primary Health Care Association. I'm not sure if Dr. Young or Latham's here this morning, but we work closely with them. Dr. Probst and her team from the South Carolina Rural Health Research Center, and I know Dr. Probst is here. Victory Tabernacle, Bishop Butler and his group from Orangeburg. If he's not here, I know we have members of our community advisory group here, and I would like for them to stand at this time. These are the individuals that keep us on task. Members of our advisory board for the Institute for Partnerships to Eliminate Health Disparities. I know Dr. Slaughter's here, Dr. Davis. If there are others, please stand and be recognized, and we certainly appreciate your support. They keep us focused on our strategic plan, our mission, and our goals and objectives, and I'm certainly glad to have you here this morning. In closing, I would like to issue a challenge to every individual in attendance to become more proactive in improving the health of our communities. This will be a conscious effort. You will need to make access, you will need to access all the tools and resources available to you in understanding the health needs of our communities. And it involves everything from participating in the town hall forums to becoming actively engaged in the political process and how it impacts our communities, how it relates to you and your responsibilities as citizens and individuals. There are 3 quotes that I use on a regular basis, and those that work with me know that I try to hold true to these quotes, at least one of them. When we started the Institute in 2003, James Garvin, Dr. Garvin, had just issued a statement that the goals of eliminating health disparities cannot be achieved without a concerted and sustained effort. And we knew then that that was confirmation of partners coming together, sitting together, designing research questions together, and then addressing those questions and identifying solutions. Our first lecturer, Dr. Lovell Jones, reminded us that in the last 2 decades, we've made very little progress in addressing health disparities. And then my quote, lift the people, lift the community, and you will lift the nation. It draws from Hebrews 12:12, and everybody that knows me that I stand firm to those words, so don't get upset, this is me. Wherefore, lift the hands which hang down, and the feeble knees. That's what we have to do. We are our communities, and building a healthy, equitable future for each of our communities is the true test of our time. I certainly want to thank Congressman Clyburn for his thought-provoking comments, message, the challenge he has issued to us, and something that he always reminds us of, our history. If we know our history, then we're less likely to repeat the history. I don't know about you, and I started not to say this, but I think I should. Off script again, sorry. But every negative remark that was made towards Congressman Clyburn and other members of Congress as this legislation moved through, every derogatory act that occurred was done toward me personally. So while it may look like Jim Clyburn did this for Jim Clyburn, he took those remarks and those acts and those actions for us. And Donna Brazile was here a couple weeks ago. I know some of you were there. And she said, the only thing she was asking of us is that the next time Congressman Clyburn, our congressman, got back to South Carolina, she didn't know when it was going to be, how soon it was going to be. When he came back to the 6th District, came back to South Carolina, the very least we can do is thank him for taking the hits, taking the remarks on our behalf. And I thank you. I thank you. We will now, if you don't mind, ask you to come back and entertain those questions. Laurel, are you ready? And following the Q&A, we will have a reception in the rear of the ballroom, and we certainly have posters on display that represent some of the health disparities research our faculty and students are involved in. Please take time to stop by the posters, talk with those researchers. And again, thank you for coming, and it's my hope that you leave with renewed commitment to framing and addressing, and in a very meaningful way, the core issues of health disparities. Thank you so much.
Thank you. Let me just thank Dr. Glover for getting me started in this effort. I would be remiss if I did not admit that the commitment that I've got to this issue was really nurtured by her, and I thank her so much for it. I want to say this while they're gathering the questions. She mentioned this effort started 7 years ago. At Claflin University, there's a little effort that we have going on at Claflin involving the STEM programs, science, technology, engineering, and math. There's an effort down at South Carolina State involving transportation, which is very, very critical to our #1 industry in South Carolina, which is tourism. I could go through all of these schools. Allen, where I was on the day before, day before yesterday and the day before that, where we have been working on efforts there. At the Multimedia Center and STEM programs, I often hear about how many mathematics majors they got now at Allen as opposed to only 2 or 3 about 7 or 8 years ago when we started paying close attention to trying to get programs going on that campus. I can go to Morris College. I can go through all of these, Dr. Davis. Thank you so much for being here. Every one of those efforts, every one of them, they were all started with an earmark. I just want to say that. Now, you hear all of this stuff about how bad these things are, but when you have schools coming to you and say, we've got this idea, there's something we can do to fill a niche. Only transportation center funded in the state is down at South Carolina State. When Clemson University came to me and said, we got an idea. We think we need to get more African-American males as teachers at the elementary school level. Because what has happened over time, when I was coming along with Jim Felder back there, Mr. Brogdon, Prof. Johnson. Prof. Johnson was my 6th grade teacher. There were a lot of men in the classroom at the elementary school level. All of a sudden, we looked around the other day, and there were none. So Clemson University came to me and says, you know, we've got this idea that we want to put together a program to get more African American men as elementary school teachers to be role models and male figures for young people. And so we earmarked some money to Clemson. And they then worked with Claflin, Allen, Morris. Any of y'all in the Call Me Mr. program? Anybody here in that program? Oh, y'all in the sciences. Okay, I understand. That's all right. These are elementary school teachers. And we started the Call Me Mr. program. That was an earmark. So I just try to say to people every chance I get, let's don't throw out the baby with the bathwater. Yeah? Let's don't do that. Right now, we just saw that the state of South Carolina, the House of Representatives anyway, eliminated all age funding. Now, this is a very serious time for that to happen. I've met with Bambi, if you don't mind me calling you Bambi, a couple of days ago, and we were trying to figure out how can we do something about this to keep their efforts going. If I'm able to do anything at all, it's going to take an earmark. That's all. So I'm just saying that we ought to be very careful when you have 2 or 3 people. I grew up in a parsonage, and I remember some of the meetings and discussions that took place in the church, around the breakfast table. And every now and then there would be problems with a minister. My father was the president of the Presbytery. I learned a lot of decision-making from him. They didn't burn down the church. They got rid of the minister. That's what they did. So if you got problems with somebody with an earmark, you have to get rid of the earmarks. Get rid of the guy you got the problem with.
That's right.
And a few of them are in jail now.
Before we begin, Congressman, on behalf of all the students here, students at their respective institutions, and as president of the Black Graduate Student Association here at the University of South Carolina, I just want to take this time to say thank you on the behalf of the work that you and the administration have done for all the students. Thank you. Now we will begin with the question and answer. The first question reads, what was the biggest surprise in the recent health care debate? The biggest surprise that you encountered?
There are about 3 things that I consider to be turning points in this debate. One came when we were having a very serious problem that never got the public's attention. Everybody was focused on whether or not we had these 8 to 12 people, really in actuality it was just 6, but that were focused on the whole issue of whether or not what the Senate did in its language would allow federal funds to be used for abortions. And that was a big thing that everybody talked about. But the problem that was going on within our caucus was something called regional disparities. Now that has to do with reimbursement rates for providers. Now, a lot of these reimbursement rates are arbitrarily set. So there were people, especially in the Midwest, who were extremely concerned, of course some of us in the South as well, over whether or not this health care bill would lock these reimbursement rates in at the low level, because providers got reimbursed at one level in some communities, especially rural communities, as opposed to what they got in other communities. And that was actually our biggest problem in trying to get this thing done, because there are states, I'm not talking about, and then you would have a state like, say, Maine, right next door to Massachusetts. when a provider right across the state line in Massachusetts would get a certain rate for reimbursement rate, and right there in Maine, a couple of miles away, extremely lower. So much shoe from Maine was a problem for me. Kind in Wisconsin, and they had gotten together, and they had much more than they ate, and we had to get that resolved. So the biggest and most pleasant surprise came when Javier Becerra, who was vice chair of our caucus and my classmate, we were elected together back in 1992, and we were very close friends. He's very prominent in the Hispanic caucus. Nancy Pelosi assigned him to try to get the disparity thing worked out. Mike Doyle of Pennsylvania was assigned to work with Stupak. I spent almost every evening over dinner or libations with Stupak. So I was never really all that concerned about the abortion thing. It was the regional disparities. And when Javier announced that he thought that issue had reached an agreement, that was the biggest surprise to me, because I really felt that there was anything that could derail this bill. That was it. The other stuff I thought we could work on. But you can imagine what whole states look like. Or even within states in Florida. The people in Miami got this big reimbursement rate, and you go right up the street in Tampa, Florida, and it was way down here. This was a big, big problem for us. So that was the biggest surprise to me, and it was the most pleasant thing is when it was announced that that had been worked out.
The next question reads, do you believe that in your lifetime, the USA will stop seeing health care as a commodity to be bought and sold?
Yes, I do. I really do. I think that we are the last free democracy to do this. And I really believe that just as people look back on some of these other things that we were so exercised about and wonder, how could we have ever had that kind of collective thought? Sometimes I ask them, you ask them, why did I feel a certain way? And, you get together and you see that's what makes it collective. But it's amazing to me. We had, I guess it was Tuesday night when we had the Washington night in South Carolina. That's a thing we have every year during our Easter break, when all of the Congress, the members of Congress, our entire delegation, every now and then somebody doesn't show up or go on a coattail. But Tuesday night there were 4 House members and 1 Senator, Jim DeMint. And when I walked in there that Tuesday night, there were people walking up to me, and I noticed they were getting extra close. My wife was with me, but they were getting extra close. But what they were doing, they were whispering in my ear. I'm not making this up, because I said it from the podium, from the table we were at. And they were saying to me, I can't say much in here, but thank you so much for getting that health care done. I mean, these are business people. They know what health care has done to them. I'll guarantee you, if the truth be known, or be told, because it's known, if the truth be told, we had the collapse of the automobile industry over benefits. It was a benefits. Years ago, people started giving up income, salaries, for benefit packages. And those benefit packages what took the health insurance down, the automobile insurance down. What happened was all of a sudden, the big 3 woke up and they saw that foreign automobiles were coming into this country $1,500 to $1,800 cheaper because of health care. None of those other countries, they've all got universal access to health care. These companies here were carrying these big tags on health care. So they started out, and they will tell you, they pay more for health care than they do for steel. And that was the biggest thing to drag them down. Bankruptcies, most personal bankruptcies in this country come from health care. And so I think that as this bill moves along and people begin to see how the so-called, I hate to use this term, but what we're trying to do is what we say bend the cost curve. I got tired of hearing that. What we're trying to just bring costs down. I tell people out there, what do you mean bend the cost curve? You want to bring the cost down. That's what you want to do. So here, and this bill does that. This bill, according to CBO, Congressional Budget Office, in the first 10 years will decrease the deficit by $143 billion. Here's the biggie. In the second 10 years, it decreases the deficit by $1.2 trillion. That's what CBO says. That's not us. Some of you may have seen the TV program right after that. They asked me, what do you think? I said, that report makes me a little bit giddy. Because we were worried about what this is going to do. When you hear people say, how can we afford this big price tag? The question ought to be, how can we afford not to do this? Because if you look at the last 10 years, and premiums have doubled to individuals over the last 10 years, they've doubled. And they will double again over the next 6 years without this bill. Everybody knows that. So I don't understand why we look at this and says, we can't afford to do this. We can't afford not to do this because of what it's doing to individuals, what it's doing to businesses, like the big three, the Small Business Chamber of Commerce, what it's doing to hospitals. People ask me, I remember when Chuck Todd asked me at some point in the middle of our discussion, I think he thought he was going to catch me a little bit off guard with that. He wanted to know, well, you just mentioned this $143 billion in the first 10 years, $1.2 trillion in the second 10 years. Will you explain to me how you can spend so much money and then bring the cost down so much? Well, sure. Just talk to my people who run hospitals in South Carolina. And I told you I brought some stuff with me. This was a letter that I got. I thought I had the letter from the South Carolina Hospital Association. They were supporting this bill big time. Why? Because they know that under current law, they don't have a choice. Anybody that show up at the emergency room, they got to serve them. And they know that 42% of the people that show up at the emergency room don't have emergencies. They're coming in for primary care. And so that's how you bring the cost down. You get these people out of these emergency rooms and the hospitals, the costs come down. The cost shifting leads the system. My wife had a bypass surgery about 6 years ago. And it's kind of interesting, on the day that the second day after the surgery, I was standing in the hospital bed, and she told me to look in her pocketbook and hand her an aspirin. Now, we met, that jail we met, that was 1960, And we got married the next year, 1961. Now, I looked in that pocketbook. I was just kind of playing around because you don't stay married as long as we've been married by going in your wife's pocketbook. So I didn't want to go in that pocketbook. So I said to her, Emily, why don't you just call the nurse and ask her to bring you in the aspirin? I can't find the aspirin. She said, will you give me the pocketbook? I'll find the aspirins. Because when you see this bill, you see why I brought my own aspirin. I think that's because of the cost shifting that took place in the system. She was a medical librarian out at the VA hospital, so she knew about it. I didn't know. I was just a member of Congress. I didn't know all that stuff. So here I am. You just think about it. Somebody's going into the hospital to have a 5-vessel bypass surgery, and she's worried about carrying aspirins. I saw the bill. Every aspirin costs $15 each. Not a bottle. One aspirin, $15. Why? Because she was paying for all the other people that show up there without insurance, and the hospitals are trying to get rid of all those people. And I'll just read you what this says. Given the rising cost of health coverage and the rate at which people are losing coverage, the number of uninsured South Carolinians is likely to skyrocket if Congress doesn't pass health care reform. This is the Hospital Association. This is their letter. That's why South Carolina hospital leaders are urging the United States House of Representatives to pass health care reform this weekend and thanking Congressman Jim Clyburn of South Carolina, 6th District, for his strong leadership on the issue. That's their letter. And we distributed this letter to everybody, and it stopped a lot of that foolishness. So this is going to prevail, I believe, in the long run, and people will look back and say, that is when we decided that health care is a fundamental right for every American and not a commodity to make money off of.
Congressman, some of the questions are similar, so I'm going to try to combine a few of the questions in essence of time.
Good.
One of the questions read, when should we expect to see concrete changes as individuals? Or in other words, how long will it take to see the effect of the health care bill? And another question in addition to that says, how will it look to consumers?
Number one, immediately, here are some things you're going to see. Number one, it is immediate that if you are not yet 26 years old, you can stay on your parents' policy up to your 26th birthday. That's right now, R-A-T, right now. Immediately, if a child is born into your family with juvenile diabetes or some other catastrophic illness, that child is immediately, right now, covered by this bill, now law. Now, it kicks in for adults 4 years hence, but for children, that's immediate. Now, you may recall that 2 days after the bill, there was all this foolishness coming from some insurance companies saying there's a little quirk in this law, and we think we don't have to cover that. Well, the pushback was so immense, within 24 hours, they said, we will honor the intent of Congress. We aren't going to fool with that, and they are going to cover these children immediately. There is some stuff on rescissions that take place immediately. Some of it is postponed, but there's some things for new plans and all that take place immediately. You will start seeing an immediate impact in many of these areas. Now, the exchange, the so-called exchange, will not be set up for 4 years. And that is the competition that you're building into the system with all the insurance companies that will come into the exchange. That will happen in about 4 years. But there are significant immediate impacts in this bill. Now, if anybody has something particular in mind, I would be glad to try to tell you whether or not that's going to be immediate or in 6 months, because some things will kick in 6 months, and some things will kick in 4 years, and there's a pay-for side of this that will not kick in for 8 years.
The next question reads, what are your recommendations, or you could say next steps, to address the intersection of health and poverty in South Carolina going forward? I want to add to that question, are there any opportunities or initiatives in the health care package for small businesses to address those types of intersections?
Absolutely. I also have a letter here from the Small Business Chamber of Commerce, Frank Knapp, who heads that up in South Carolina, one of the founders of that, a very strong supporter of this bill. And those of you who read the state newspaper, if you looked at Tuesday morning, State newspaper, there was an op-ed piece authored by Frank Knapp that went through all of the benefits to small businesses that you find in this bill, some of which kick in immediately. So there is dramatic changes for small businesses. Most small businesses will tell you that that is 97%. 97% of the businesses in this country are classified as small businesses, and they are big for this bill. The problem is there are small businesses that don't have a big budget that they can put on buying ads and doing all kinds of stuff to get over the airwaves and make you think that the attitudes are different. But 97% of the businesses in this country support this bill. Now, as far as what it will impact economically, the one thing that everybody agrees to, that the one field that did not suffer significant losses in the last 2 or 3 years has been the healthcare field. And this bill, according to the experts, will create 400,000 new jobs. How does it do that? This bill invests $11 billion. This is a B now. $11 billion additional dollars in community health centers. It will double the number of community health centers. And why does it do that? Those of you who watched the summit at the Blair House, you may recall when the president called on me, I didn't talk about bending the cost curve. I didn't talk about whether or not there was going to be reductions in premiums or whatever. I said, Mr. President, no matter what we do, the bill that we are debating here today will expand coverage. At that time, 31 million, we got to 32 million people. Yet we all know there are 12 million that need health care. I'm sorry, 45 million that need health care. That means that 12 million people will be left off the table. What's going to happen to those 12 million people? We all know that the best way to bring costs down in health care is through prevention. So how do you do prevention? You can't do prevention by putting up signs, at all due respect, Saber Slaughter. Saber Slaughter took me on a tour of the Children's Hospital down in Charleston a few years ago. Now, they're doing great work down there, so I just like to tease them a little bit. But they were taking me on a tour, and so I went around this tour, and I saw the sign, brush your teeth every morning. Now, how long have we been seeing that sign? That's all the prevention I saw. So you cannot do prevention by putting up signs. The best avenue for prevention, community health centers. That's the best way to have prevention. And it is the ultimate safety net in the system. So those 12 million people who we aren't extending coverage to, they're going to end up in the emergency rooms, and the emergency rooms need to get them out into community health centers. That's why Health IT, I call it the HIT program, HIT, Health Information Technology, is so big in this bill, because what we're trying to do with this bill is hook up community health centers. There are 40 of them in the 6th Congressional District. I don't know exactly how many in South Carolina, but we're trying to hook up every community health center to USC Medical School or MUSC or hospitals all over this country. I see Tom Baumboy here from Buford Jasper, the Comprehensive Health Care Center down there. We just got them, what, y'all got $7 million the other day for your other factor. And that was $7 million out of the stimulus package, y'all. There was $5 million that went to Little River out of the stimulus package. And so everybody that said Jim Clyburn is filling his own nest, that center ain't in my district. Little River ain't in my district. So it's not about my district, it's about my state. And I am doing what I can. And so we did that. I love Tom Ballard. I plan to see him over the weekend. As soon as we get out of here, I'm going down there in your county. I'm going to be on Hilton there, and I'm going to look you up. You're going to buy me dinner either tonight or tomorrow night. And I don't have to worry about the gift rule with you because we are longtime friends.
Congressman Clyburn. Unfortunately, we only have time for one more question, but I do want to address the audience and let everyone know that all the questions that we received, we will be posting answers on the Institute for Partnerships to Eliminate Health Disparities website. So you can view that website, look it up in Google, because I can't repeat it right now, and you will be able to find the answers to your questions really soon. So this will be the last question, Congressman. In your opinion, is there any hope of meaningful collaboration between Republicans and Democrats in the near future? Stressing the near future.
Did you say hope?
I said any hope, Congressman, any hope.
Well, as I said, I was born and raised in the parsonage. And if my good friend Sandra Glover can quote from the 12th chapter of Hebrew, I think I can quote from the 11th chapter of Hebrew. And in the 11th chapter of Hebrew, the first verse, you find these words: faith is the substance of things hoped for, the evidence of things unseen. I hope and see no evidence, but I have faith that it might.
Thank you, Congressman. Thank you, Congressman, for your gracious time and your efforts up in Washington, D.C. At this time, the platform will be excused from the auditorium. I would like to invite everyone in the auditorium to take a look at the posters that are out in the lobby and along the hallway. A lot of hardworking students, graduate and undergraduate, have put their blood, sweat, and tears into those pieces of information. We would also like to invite everybody to join us in the back of this auditorium for the reception. Thank you, and have a good rest of the day. Attention, ladies and gentlemen. For those of you who would like to meet with the Congressman, he will be joining the reception a little bit later, so stick around. Enjoy the reception in the back of the auditorium, and he'll be back shortly in about 10 or 15 minutes.